The medical, emotional, and spiritual challenges of a life-limiting illness are often overwhelming for a patient and their family. For help, more and more Americans are embracing hospice, a comprehensive program of medical care that provides emotional and spiritual support to patients and families battling a disease or condition that can no longer be treated. According to the National Hospice and Palliative Care Organization and the National Association for Home Care and Hospice, 1.4 million people received end-of-life care from a hospice in 2009.
A lot of times you hear hospice is a place you go when it's time for you to die, when there's no other treatment available, they're just going to keep you comfortable. Those are the biggest misconceptions I hear. Actually, hospice is very involved with your care. You still receive very good treatment. Most of the time when you're in hospice, it's so that you're part of the care, you're involved with it, and that your interaction and that you have a say-so in what goes on in your care.
In the 30 years since the inception of hospice in America, healthcare has changed drastically. Many diseases that were acutely life-threatening have shifted into chronic illness, which require different models of care.
Hospice is able to provide those patients who have actually had no other avenue to turn to, who are chronically ill or have diseases that have reached a point that there's not conventional, necessary, aggressive treatment available, or if they feel they've reached their maximum treatment and when they decide on their own to make the decision that they want no more aggressive treatment, they can actually pursue hospice. Hospice care basically is traditionally defined as an illness that may be terminal or around a 6-month life expectancy. Palliative care is more symptomatic treatment for disease states that have either been terminal or long-acting and require relief of those particular symptoms, whether it's pain, shortness of breath, or whatever your symptom is.
Formed in 1996, Community Hospice of Baldwin County is a not-for-profit hospice agency providing community-based care services to terminally ill patients in Baldwin, Escambia, and Mobile counties throughout Alabama. Its caring staff supplies the care necessary for the physical, emotional, mental, and spiritual well-being of patients with life-limiting illnesses.
Hospice is an end-of-life model of care that the focus is not cure, it's on caring and on symptom management, and it wants to bring in the family and the patient to be sure all of their needs are met. Our mission has been and will always be that our patients and their families are our priority and their needs will be met. And when you look at a plan of care, it's like a living thing. It changes as the needs of that patient and that family change, which are assessed at regular intervals by our interdisciplinary team. The hospice services that we offer are physician services, registered nurse services, home health aide services, social worker, chaplain services, bereavement services, and also the different therapies, which are occupational therapy, speech therapy, physical therapy, and dietary therapy. We also have very dedicated volunteers who mean so much to our hospice.
My mother was diagnosed with terminal lung cancer. It was inoperable and her doctor recommended hospice. Community hospice provided services to my mother which helped her tremendously along during her illness. It made her time and quality of life much better.
Put yourself in that patient's role. What would you like done? How would you like to have it done? But I think the most important thing is ask around if you're concerned. Find out about hospice, attend meetings, support groups, talk to the nurses, speak to other patients who are involved with hospice.
When I first started in 1998 and was actually caring for the patients and being with the family members, at the death of their loved ones, I heard frequently, "We couldn't have done this without you, without community hospice. You've meant so much to us." And when I asked them, it was that we were there. You were always there for us. We picked up the phone and called you, and you're always there. We get referrals and they say, "You took care of someone else in our community." And their families said, "If you ever need hospice, use community hospice."
Being the primary caregivers of my mother, my brothers and sisters and I were not as comfortable to take care of her as we should have been. But with the help of Community Hospice, we were able to take on that responsibility and to make the end of her life care be everything that it could be. It was a wonderful experience to have the time to spend with our mother until she was no longer with us. And that made it possible and made us so happy at the end of her life.
There is the potential for growth in an end-of-life situation. And that's where hospice, with their expert team members, we come in and we help them with hope of spiritual renewal, hope of renewed family relationships, hope of a peaceful death, hope of relieving the burden on their family, and knowing that after their death, their loved ones will be okay. They will have that sense of peace, and hospice is there to direct them and help them to reach that. And I think that's how we help them bridge that gap of fear that they have.
The most enjoyable part for me in my day-to-day interaction with hospice is knowing that at the end of the day, that one, that patient received great care, two, they were in a loving environment, and that there was something for them to have where they felt they were part of their treatment and they didn't feel alone.
The greatest gift to me that you can give to your loved ones is an advance directive, because if you know that you're following their wishes, it's a little easier to make those difficult decisions. Choose the best. It's your choice. Choose Community Hospice.
When time is short and medical science has no more to offer, hospice is a family affair that offers the promise of comfort. Learn more about Community Hospice of Baldwin County, committed to changing the way dying people in Alabama are cared for forever. For more information, go to comhospice.com or call the number on your screen.